So if we're looking into treatments for TMJ issues or temporomandibular dysfunction, we need to think about it as like when we've talked about orthopedic stability, almost like physical therapy for the jaw. If you sprain your ankle, the joint is out of balance, there's inflammation. You can put a brace on your ankle and they just tell you just don't walk on your ankle or for a while and stay off your feet and things can get better. But you can't do that with your jaw. You can't say, okay, just don't use it, or let's brace your face or your jaw. It's not realistic with our lives that we live. But we know mechanically that the lower jaw hinges and moves forward and it opens. So if it's out of alignment, we can use the upper jaw that's balanced and fixed to guide the lower jaw back into its correct position. So an orthotic, a bite splint, there are many names for it, but it's the most valuable tool we have in dentistry that we know if we balance the bite, we can balance the jaw. So it all starts there with orthopedic stability. So if you think of that, if the one leg's too short than the other, that if you have a custom orthotic that goes in that shoe, it now is providing skeletal stability. As long as it's in the shoe, you feel balance within the body. Same thing with TMJ treatment. The custom orthotic that we make to fit on your upper jaw, that snaps in your upper teeth, that as long as it's in the mouth, it's providing stability and balance skeletally to your jaw joints, the jaw muscles. It's allowing kind of down regulation of the sympathetic nervous system to decrease inflammation, allow muscle health and stability. And when we go through the orthotic therapy for people, for the TMJ treatment, that it's a commitment. So we know when I work with you, when I say it's a commitment, that if you can commit to wearing this full time, it's like it's always in the shoe. If it's always in the mouth, that for a period of anywhere from 3 to 6 months, depending on the severity of the TMJ issue when we do our diagnosis, that I know we will be able to get things back on track. And when you make that commitment, the longer you wear it, the more follow-up therapy appointments I have with you, the more accustomed your body gets to having it in place, the better you're going to feel. So the best and the most cool part about the therapy and the treatment is we don't really manipulate anything at all. The orthotic sits in the mouth on the upper jaw, and we're letting your own body, your own biology, heal on its own. So we're not pushing, pulling, tugging, using lots of force, like doing a lot of things and saying, you have to wear like this during the day or wear that at nighttime. It's a very, holistic, biological driven process that we know that within our body, the biology of bone, when it's breaking down or it's not healthy, it can take 3 to 6 months to fully heal, to fully realign. Just like if you have a cast on a broken arm, if the cast is in place, you're going to get healing. If it came off too soon, maybe there's incomplete healing. So, if I can work with you and you can make a commitment and we work together as a team, that's always the first step and first phase of treatment. I've done all this myself. I wore the orthotic for 7 months, got my dad to help fix and realign my bite and get the jaw to feel better. So I know what it's like and how it feels. And most adults, after a period of time, they will always say, this actually just feels better wearing it. It feels better in my mouth. And I love hearing that because I know the treatment's going well and it's going to be easy for you, and as soon as we can get to that standpoint, which maybe it's a day or two or a week or two or a month or two, that we know we're moving in the right direction. So the jaw orthotic and the orthopedic stability is always the first step within therapy. And then when we get to the end of that treatment, say in 3 months you're feeling much better, like, oh, my jaw's not clicking, my pain's gone, like I feel great. Okay, well then we're at a crossroads, and at that crossroads we can say, okay, well, if you want to, you don't want to do anything more, then you can wean off of wearing that 24/7 and you're just wearing it at nighttime, and that's kind of your insurance policy to just help keep your jaw as comfortable as it can be. Or maybe we take the other path or the other fork in the road of saying, hey, let's make more of a permanent fix. Let's, try to prevent this fully from coming back. And that's when we can get into the orthodontics or Invisalign, or, maybe it's jaw surgery for people if skeletally the jaw's, out of position, or, it's biorejuvenation, what we call, adding synthetic biocompatible enamel back to the teeth that are, chipped or worn or broken to balance the bite. But it always starts with, our initial diagnosis, our 3D jaw diagnostics, and working with our jaw orthotic for orthopedic stability.